wow, people are streaming in. Oh, wow, quite a few are streaming in. Give people a couple more seconds because I just see that we had about 8 people just join in right now. But while we're doing that, if you all don't mind just renaming yourselves if you have not already, essentially your name, your municipality, or organization that you're representing, and your pronouns. So mine, as you see here, is Raul Gonzalez, MAPC, he, him, his. So yeah, I guess we can jump right in and welcome everyone. Thank you so much for joining us today for an introduction to the Racial Equity Advancement and Collaborative Hub. So it's REACH for short. We love our acronyms here. We hope to convey an initiative that strives to foster municipalities that are not only inclusive and equitable, but also reflective of the communities that they serve. Through REACH, we provide a dynamic space for municipal teams to engage in meaningful dialogue, absorb new knowledge, and strategically plan for racial equity that permeates city government or town government and community interactions alike. And we are pleased to have you here. Can you all see the screen that I'm sharing right now? The PowerPoint? Great. I'm going to just go to the welcoming slide or the agenda slide. Today, we wanted to go over the program, the application process, and then open it up to your questions. Though feel free to incorporate questions within the chat box as well. As some of you may know, the REACH program draws upon the foundation laid by the Racial Equity Municipal Action Plan program, or REMAP, which was a partnership with the Federal Reserve Bank of Boston and the Government Alliance on Race and Equity, or GARE, under Race Forward. Through the REMAP process, 6 municipalities participated in a peer-to-peer learning experience to develop racial equity action plans with a focus on policy and practice change. The program's goals included learning, training, self-assessment, and reflection on racism and racial inequity, followed by the creation of action plans committed to addressing racial issues. By expanding our scope and deepening our impact with the aid of our skilled partners here at GARE, REACH is a racial equity program aimed at equipping municipalities with the knowledge, tools, and support necessary to advance racial equity through informed policies, practices, and collaborative efforts. And without further ado, it is with great pleasure that I introduce you to Mr. Gordon F. Goodwin, the Senior Director of the Government Alliance on Race and Equity. Under his leadership, GARE has emerged as a pioneering force, offering tools, strategies, and a powerful network, all designed to transform public policies and systems. Gordon is a true advocate for change and an ally in our mission to advance racial equity within our municipalities. I'll pass it over to you, Gordon.
Thank you very much, Raul, and thank you for that very, very kind introduction. There's a team of people at GARE, some of whom are with us today. Janine Cristiano, who is our director in charge of strategic partnerships, Jared Bean, who works very directly with getting the great program going for GARE, and Becca Lobley, who is also supporting our GARE portal. So just wanted to give them a shout out. And if I left anybody out else who's here, please let me know, just put it in the chat. So I'm here to tell you about a community as well as a program that is a network of practitioners working across the country, people just like you who are working in government, who really are trying to ensure that we meet our obligation and our stewardship obligation to serve everyone in our communities with respect and with the services that they need. And the GARE vision and mission, oh, I'm so sorry, I should have also not left this out. Karen Shaban, who is also with us, is an extended member of the GARE team and has provided significant support to the REMAP, which came before this, but also to REACH, and is one of our partners in equity and has had a long career in doing this work as well. Sorry, I didn't mean to leave you out, Karen. Apologies. But this GARE vision and mission is something that was actually developed by our steering committee. So this vision, which really sets, what is it that we would like to see as a change in the world? Racial equity leaders and practitioners who are designing and implementing strategies that transform government. That is, change it from within. Because the work that you do with the public every day and the way that you do it can actually have significant impact on people's lives. So that's our vision, what we want to achieve, but our mission, what we as staff and as practitioners who are in GARE wake up every day focusing on is creating those connections amongst this national network of practitioners and leaders for shared learning and leadership development, to build skills, to build influence, because we are building power so that we can change government writ large. And there's accountability to achieving racial equity to the public that we serve. Next slide, please. It's not insignificant that we have a vision and mission statement for GARE. We haven't always had one. This slide is really about how we've developed over the years. And in 2014 and 2015, there were practitioners from 13 jurisdictions who came together under the support of Julie Nelson, who was our founding director, and who really charted the vision for what GARE could become, which was this alliance. It's an alliance nationally of people working in jurisdictions. And so we had one staff person who was Julie back at that time. I came on board initially as a consultant in 2016, helping out Julie to work with jurisdictions in Minnesota and Philadelphia and a couple of other places. We had 42 governmental jurisdictions that were members by 2017. So I came on board in 2017 as a staff person, or maybe about 4 or 5 of us working at that time. But in 2018, we had about 10 staff. In 2019 and 2020, we were bumping up on about 200 members, 180 to 200. And we added additional staff at that point. But in 2020 and 2021, after the summer of racial unrest and the summer of awakening after George Floyd's death, I'm speaking to you in St. Paul, Minnesota. I'm approximately 3.5 miles away from 38th in Chicago, where that horrific incident occurred. It really brought to light a lot of the intentional racism that takes place and the injustice that takes place in our justice system. But it also began to shine a light on the different ways that systems and structures need to change. And so we saw significant growth in the membership into the 300s after that year. And now we are at 435 members. When we started having significant growth, and due to the fact that we were all living through COVID, it allowed us the time to really reflect on how the GARE model needed to be different. Previous to this, we had staff who were attached to specific regions of the country, who were the principal point of contact and were accountable for providing trainings as well as providing the coaching and other types of technical assistance that jurisdictions needed. But with a large number of jurisdictions coming on board, became pretty difficult to just sort of deploy people to do trainings all of the time. So we needed new ways of doing the training work and new ways of lifting up the contributions of jurisdictions. So that brings us to where we are today. Next slide, please. This next slide just gives you a little understanding about when we talk about jurisdictions. You could go back to that one. Thank you very much. Right. Who is in GARE? And we've got 207 cities. This is a count as of last Friday, just after we had finished our annual membership meeting, which took place last Thursday and Friday, and to which I think there were about 400 attendees. You can chat the correction in the chat, either Becca or Jared, to correct me on that. But 77 counties. So for cities, important for you to understand, we have a very active partnership with the National League of Cities. In fact, the chair of the board of the National League of Cities, who is a mayor from Washington State, actually opened up our convening with a welcome. We have an active partnership with NACO. So you see 77 counties there, a National Association of Counties. There are 43 different departments and offices some of which are mayoral offices, others of which may be offices for counties. There are independent drain districts and other types of segments of government that are part of GARE, regional governments. We have a thriving group of councils of government, and I want to point out that Karen does work with the Washington Metropolitan Council of Governments. Did I get that right? Or it's the DC COG. That's it, isn't it, Karen? Thank you. All right. Council of Governments, but is among several that are involved in GARE. That's extremely important because they hold some of the infrastructure for conversations about racial equity that are important to this work. And MAPC is also in that vein in terms of us as a partner. And we are very thankful for councils of government holding place for how this work gets done. Special taxing districts and then states, which are really coming on strong. We have state executive offices and state departments that are joining with us. That gives you a sense as to who GARE is, but this scale piece, it's not just about the numbers. It's about how we work together collectively to use our influence to change the way that government operates. We'll talk a little bit more about that, some of the upcoming slides. This next slide, thank you very much, Raul, just gives you a sense as to where the membership is located throughout the country. And we have significant presence on the East Coast and in the Great Plains, as well as the Great Lakes. Some presence that's really growing on a regular basis in the South. Colorado has been, in the West, has been one of our faster growing segments. We had 2 years ago, 14 jurisdictions. I think we're at something like 38 or 40 right now. And California, which is where we have had really good support, as well as Washington State, Seattle, and Portland, Oregon, and the environs beyond that are some significant GARE strong points. But note, Utah, Montana, there's still representation there, as well as in Arizona and New Mexico. So we are everywhere and we are growing, and we'd love to have you as jurisdictions participate in the network. Next slide, please. So one of the things you might ask is, there's a lot of conversation about DEI. Sometimes I hear it referred to as D&I, leaving out an important aspect, the equity piece. But why do we lead with race? So one of the things you will learn as part of your experience, if you aren't already aware of it, is that government has played a significant role since before the country was a country in actually creating the laws and enforcing the laws that kept people from participating in our economy, in our civic space, from owning land, from being educated based upon their race. And government was very explicit about that. Some of the early actions of the Supreme Court were about determining who was white and who was not white. And that set the tone for whether or not you would be participating in our society. And that was the law for a significant number of years. We may have had our first Civil Rights Act shortly after the Civil War, but then had to do a complete redo of that for the 1964 Civil Rights Act, and then a 65 addition to that, and then the 68 Housing Act, right? So the racial inequities are deeply woven into our society, and we're deeply woven into our law. Race is often an elephant in the room. Oftentimes we talk about things like whether or not there's going to be economic equity or whether or not there's going to be housing equity. And when we start peeling away and taking a look at the numbers and drilling down and disaggregating the data, we see that race plays a significant role in who cannot afford housing, who does not have enough housing to support the type of family that they have, and where there are resources available, where there is housing that is underutilized or hasn't been improved, where there have not been improvements made to public infrastructure so that people can be connected to employment and to jobs, where there has been disinvestment over time. And it all follows race. Redlining has played a significant role in that, as well as whether or not a jurisdiction had laws against actually transferring mortgages and selling them to people of color. So that's something that we need to acknowledge because it impacts the landscape that we are working in many of our jurisdictions to the present day. Learning an institutional and structural approach, which is where we focus our work, also helps us with other areas of marginalization. We'll talk about that again in just a second. And when we are specific about race and we ask jurisdictions to be specific when they are focusing on equity, to have the race and equity go together. Because when you leave race out, you have a tendency to leave out communities and their input on how we get to better decision-making. And we also have a tendency then to have equity matter for all types of other areas of difference except race, because oftentimes people find it uncomfortable to talk about. So we're race focused, we are not race exclusive, which brings us to the intersectional analysis. Next slide, please, Ro. So the race and framework, right? So whenever we're talking about race and we're talking about other areas of difference like gender and immigration status and sexual orientation or religion, race often acts as a weighting factor for how much exclusion you have or how worse off your situation is. When we take a look at race and poverty, we see that there are significant differences in experience. For Native Americans, I think it's closer to 25 to 30% in poverty. African Americans, 20 to 25%. For Latinos, 17 to 20% in that area. For white people, often 10% of the population in poverty. So when you take a look at these particular areas of focus for our work, when we leave out race and we're not explicit about it, we're not actually getting at all of the reasons that people may be suffering, and we're leaving out important information from people who are closest to the problem. But race is not the only piece. Race and other areas of difference are complementary frameworks. We're not saying we don't want to focus on gender equity. We don't want to focus on immigration status and equity. What we're saying is have race and be complementary. They are not competing frameworks. And oftentimes I think we think about it that way. Next slide, please. So when we talk about racial inequity in the United States, we really have to understand that it is in every sector that people experience, all of the sectors that are necessary for us to have a good life. This particular slide is about social determinants of health theory. And social determinants of health theory is acknowledged by the World Health Organization and the Centers for Disease Control and Prevention. It's a theory that basically states that your life outcomes can be predicted from birth based upon some of the characteristics that define how you're going to be treated in our society. Race, gender are significant among those, language spoken at home, zip code. These play significant factors. And what's important to understand about this is that this theory was originally a hypothesis. Somebody just said, well, maybe that's the case. Data had to be brought to the fore. And the data that we collect every day, friends, right? When we begin to disaggregate that and start using tools like some of the tools that GARE and ESRI developed together. Some of you know that ESRI is one of the primary supporters of data visualization for government. When we use our own data to understand who is most significantly disadvantaged in our communities, we see that race is a significant through line on that. So next slide, please. So when we're talking about racial equity, it's important to understand this. If social determinants of health basically is a predictive factor in how well we're going to do, then racial equity is accomplished when race can no longer be used to predict life outcomes. When some of these disparities that we become very focused on, but don't actually start asking, what's creating these disparities? Could it be that some of the processes that we use every day, like complaint-based systems, like fines and fees, could those be contributing to some of the social disparities that we're seeing? Could it be that there's a way that we could do things differently to ensure that everybody gets a quality of service and experience that makes them feel included, that has them participating in our programs, and that actually has our community looking at as though it is one community and not some communities are better off than others, and that's the fault of those who don't have what they need, if they aren't looking that way. And so the other piece about this is when we focus on race, we actually develop ways of delivering government that work better for everybody. And if you've ever wondered about why some local libraries have decided that, we're not going to use fines and fees anymore, we can thank our friends at the Denver Library, a GARE member, for doing the pilot research on the fact that, first of all, fines and fees do not guarantee you're going to return materials on time. And secondly, they do a very good job of keeping people with little means outside of the library, people who may need it the most, and kids who may need it the most for in-school and out-of-school programs, after-school programs, as well as people who use the library where services are being delivered, for blood pressure reading, for recreation, all types of services. That's just one example. Next slide, please. So for us, for those of us who are in the public sector, for you who have sworn to ensure that not only is the public going to be well served, but we're going to leave government better off than when we found it, right? Actually improve it. The way for us to do this is to target our strategies, to focus improvements on those who are worse off in the communities we serve. What I am saying to you is that reaching 80% of the people, but 20% of the people not actually having an experience that 80% of our population has is no longer sufficient. It is no longer excellence. What I am calling us to do is to really start focusing on those parts of our communities, particularly communities of color, where the lack of access, where the lack of trust, which is born largely by the fact that their experience has not been one that has been rewarded with, yes, we hear what you're saying and we're responding, right? That until we're able to ensure that all people, and particularly those who are most significantly feeling those gaps, are experiencing government and are benefiting from it in ways that people in some of the wealthiest parts of our communities are, that we are not doing our job as public servants and public stewards of the public good as well as the public purse. Not doing our job. So changing those practices and institutions and structures is how we do that. And where we focus on that in GARE is on the institutional practices, many of which get us some of the efficiencies that we want. You heard me talking about complaint-based systems, something that governments used time in and time out. How we use public meetings in ways that are often very efficient, but often don't actually work for everybody. We've got to start changing those things if we want different results. And that can be difficult. Notice I'm not talking about changing how people think. 2 weeks from now, many of us will be sitting down around the Thanksgiving table, and we're going to be engaged in conversations sometimes with family and friends, that we've been having for years. And it gets down to the same old arguments about why we believe in the things that we believe in. And if you think, if you haven't had a lot of success at the Thanksgiving table, first of all, if you're not having that dynamic, you might want to ask the question, well, maybe it's me. Maybe I'm the person, right? That people don't want to have the conversation with. But if you haven't had success at that Thanksgiving table, don't think you're going to have more success actually talking to people who you work with every day about changing their minds. We need to change the tools that people work with. And so I think that is just about the end of my time. And have I overstayed my time limit? One more piece. Very good.
You have this one component left, but please go over it.
Fantastic. So you might ask yourself, great, Gordon, okay. So I'm hearing what you're saying, but how does this actually work? Is this just, we're just going to have a bunch of meetings about this? No. The GARE approach is grounded, first of all, in visualizing how government can be different. What would it look like for our regional economy if the 20 to 22% of the people who are not participating were fully participating, employed, going to school, bringing life to our civic organizations? What would that look like if we didn't have racial disparities? Wouldn't that be something if we could accomplish that? And I want you to think about it quite literally. Where are the areas where we're seeing disparities, where institutions are having challenges, where they're failing people, where we're seeing the most distress? Criminal justice systems, schools. How would we begin to think about what a change might look like, assuming that it's not all the fault of the people who are participating? There's significant challenges with those institutions. If we can begin to visualize that, understand the numbers behind it, and start thinking about how this becomes a challenge of working with those institutions, with local government, and what are some of the things we could change, then normalizing the conversation, the second step, is really about how we become more comfortable actually talking about race. And there are shared analysis and definitions. It's important for us to remember that people don't like to talk about race because when we talk about race, we're going to talk about racism. And if we don't have a lot of experience, I may say something that's untoward, and then I get labeled a racist. It becomes a career-ending moment. And the last research that I looked at indicated that being called a racist was somewhere at number 1 in terms of fear. Actually, it was number 2, right behind being called a child molester, okay, in terms of social stigma. So that's some of the reasons people don't want to get engaged and involved. And that's people across the spectrum, regardless of your race. So making it easier to talk about it means we've got to be clear about the definitions we're talking about, and we've got to make this a priority, one that is embedded in our actual work systems and structures, not just something that is, an elective. Once we get to the normalizing aspect of this, and this is happening all at the same time. This is not like 1 stage, 2 stage, 3 stage. It can be happening all at once. Nothing happens within structures and systems without organizing some type of internal infrastructure to get the work done. People's initials and time need to be assigned to doing this work, and having partnerships at the community level. We need to start internally many times, but developing partnerships, many of which are easy to find if you start thinking about who your jurisdiction has contracts with to deliver significant public benefits. Those are some of your partners. In the nonprofit sector, there are community associations, there are other organizations in your community that can help you understand how the data that you're looking at, why it looks the way it looks that way. So we're getting then into the area of thinking about operationalizing, using a racial equity analysis, the racial equity tools, which is a data-informed process and a community participatory process for understanding what our lines of business are supposed to do, applying a data analysis to find out how well they're doing it based upon race, based upon zip code, based upon gender, but also understanding how we begin to include community and build a relationship with community so that we are getting the information we need about why those barriers exist and what needs to be different so we can get to better solutions. So those are some of the things that you'll be learning about, as well as, because you were working with government, we use the tools of government to make change. Racial equity action plans, which have priorities assigned to them, which have resources assigned to them, which have timeframes assigned to them, and milestones are some of the ways we get work done. How we begin to use budgeting processes to introduce racial equity into our work is another piece. How we start using it in HR and other types of systems that span across the enterprise are how we do this. But this is a full-on commitment. Do not call this an initiative. Initiatives are short-term. There's a beginning, middle, and end, and they typically span let's say a mayor's, term of office. And it's not a project, right? There's some project management aspects to this, which make it real. This is a public-facing commitment to improving how we do our work so that everyone is well served, especially communities of color, which have significantly not had that experience. And now I'll turn it over to you, Raul.
Thank you so much, Gordon. I appreciate that. So Gordon will be here to answer your questions later during the Q&A session. So I'm just going to now go over the program overview and as well as the application itself. You can find this within the invitation email that you had received, as well as on MAPC's website. However, please reach out to me if you need any assistance with that. Really just some basics on the program. Each session is scheduled for the second Wednesday of each month. They're not going to change, so those are all set in stone, commencing on February 14th and ending on November 13th. These full day sessions will run from 9 a.m. to 3 p.m. and they'll be hosted at the Federal Reserve Bank of Boston at 900 Atlantic Avenue. These will be all in person so that we have the opportunity to learn and network in a space that's conducive to the program's mission. Each session will have municipal teams, more on that later, that will engage in collaboration and knowledge exchange to learn about and draw support from the racial equity challenges and advancements that other municipalities have through peer exchanges. Out of the 8 sessions, 6 will be led through GARE. These sessions are designed to equip you with the knowledge and tools necessary to champion racial equity within your municipalities. The remaining 2 sessions will be conducted in collaboration with MAPC, offering a platform to learn from regional success stories and helpful resources that are right here within the Commonwealth. As we progress through these workshops, what can we expect? We're setting our sights on tangible outcomes. Municipal teams will enhance their dialogue and learning to promote racial inclusivity, make policy and practice changes to address racial disparities, engage in a knowledge exchange with other municipalities to learn from one another, and develop professionally to integrate racial equity within their roles. Within the application, you can find the timeline. Just please note that our program is designed to be responsive and adaptive, and as such, we may see changes to accommodate new developments or circumstances. I'll just zip through this really quickly. On February 14th, we'll be starting with advancing racial equity and the role of government. GARE will lead us through just the understanding of how history of racism has intertwined with government policies and practices. In March, we'll be going over communicating racial equity, which will enhance our skill set and dialogue surrounding racial issues. On April 10th, we'll delve into understanding and applying GARE's racial equity tool. The tool is vital for considering racial equity in our decision-making processes, so we'll explore that for our respective municipalities. On May 8th, MAPC will inform municipalities on the racial equity funding opportunities and technical assistance within Massachusetts. Teams will learn more about funding opportunities to just bolster your racial equity projects and work. On June 12th, we'll reconvene for a second look at the racial equity tool with GARE. July 10th will be a session on principles and practices of equitable development on building inclusive communities. We'll share insights on fostering equitable development and discuss collaborative methods to improve our built environment, ensuring that our communities are both inclusive and sustainable. August will offer a breather for us. We will have an optional summer social, an opportunity to informally connect and reflect. September will spotlight success stories within the Commonwealth. We'll hear from various practitioners about impactful projects, policies, and programs that have curbed inequity within Massachusetts, seeking inspiration and practical strategies to emulate these successes. October 9th remains to be decided, as it will be shaped through the participants and the trainers' feedback, ensuring that our program remains responsive to our collective needs. And finally, on November 13th, we'll wrap up our year with a closing event where you'll present your progress and future commitments to advancing racial equity within your communities. I'll briefly go over the application process itself and just talk about some major deadlines. First, you'll need to designate a project manager who will act as the main point of contact, orchestrating day-to-day operations. Regarding team composition, it's essential that you compile a list of all the team members, detailing their names, titles, roles, and contact information. If your municipality has a DEI position, please include that individual's details as well. You'll also need to articulate your municipality's racial equity goals within the context of the REACH program, just to help us understand. This doesn't have to be very lengthy. It doesn't have to be something that has to be fully planned out for the year. It's really just so that we can understand what you would like to get accomplished through this process. Accompanying this plan, some team activities to advance these objectives between sessions. Just kind of keep that in mind. On the financial side, please acknowledge the $5,000 participation fee. You'll need to confirm whether your municipality will cover this amount in one full payment or opt for 2 installments. Lastly, securing your, whoops, I just skipped. I got to go back to where I was. There we go. Securing your municipal leadership's endorsement. You'll need to submit a description of their support for your participation in REACH, along with a signed confirmation from an official like a mayor, a city town manager, administrator, or select board chair. Just make sure that you submit all those, and if you have any questions, to please email me. So just kind of going specifically into the municipal team, the ideal size is between 5 to 10 dedicated members. This range allows for a diversity of perspectives while still being small enough to maintain focus and efficiency in your initiatives. Who should be on this team, on these teams, is very important. I think within municipalities, the government structure, particularly through staffing, is one that is generally more direct in this realm. But a robust team may include leadership representatives, DEI experts, and heads or managers from various departments. You might also consider adding planners, staff, human resource professionals, data analysts, and elected officials. The key is to bring together a cross-section of roles that mirror the multifaceted nature of your municipality. Again, what are you trying to get accomplished? It's important that your team's composition directly responds to the municipality's specific needs. Every member should bring something to the table that will help address racial equity challenges comprehensively and effectively. If you want to change, your master planning process, and your team consists of, one representative from the public health department and 5 residents, you're not going to be able to accomplish much. Particularly a lot of residents, as active and as passionate as they are, may not fully know, the difficulties of operating through municipal governance, and that's a very important thing to be aware of. So it's really important that you think about your team's composition relative to this process. And let's not forget the role of CBOs. Community-based organizations and nonprofits can play several critical roles. They can support as community partners, contribute as core members of municipal teams, or act as valuable resources during our monthly program events. Their involvement ensures that the voices and needs of the broader community are heard and integrated into your strategies. So just kind of going over some of the main application dates to keep in mind. Particularly today, we'll be sure to share with you all the recording of the webinar. So feel free to send that around your municipality or to any partners that you may want to share that with. November 22nd at 5 p.m. is the deadline for submissions. Please email your submission to me at rgonzalez@mapc.org. We'll review the submissions November 27th through December 7th, and December 12th we'll announce the participating municipalities for the REACH program. So at that point, the municipal team should begin to fully formulate for the February 14th session and that point forward.